If you're trying to resolve sacroiliac joint pain, it's really important that we also try and understand why it's there in the first place. So in this video, I want to try and shift your perspective just a little and show you two different things that you can try to see if this has a significant impact on how your SIJ feels, by potentially going after some hidden root causes of that dysfunction and not just treating your symptoms. So let's get into it. G'day, my name's Grant Frost and I'm an Australian musculoskeletal physiotherapist who is really passionate about trying to better understand the root underlying causes of the aches, pains, injuries and dysfunctions that I see day to day. In regards to SIJ pain, over the years I've come to appreciate that we need to start thinking of SIJ pain as a consequence of something else. Yes, like most issues, there may absolutely be some local specific symptoms that you're dealing with, pain being the obvious one. From my experience, if we're just thinking about your SIJ pain as an SIJ specific dysfunction, then you could very easily be missing the bigger picture that has asked that dysfunction to be there. And in the spirit of trying to make sure that these things go away and stay away forever, it goes without saying that it may ultimately be very difficult to achieve that if we're missing all the broader context that may have conspired against you to ask that part of your body, that specific part of your body, to become a problem. So as mentioned in this video, I want to show you two different things that you can try that aren't SIJ specific things, one of which is hip joint mobility, the other is lower back dysfunction, to see if either one of these are contributing or even causing that SIJ pain. And if you're a member of the channel, I want to add in two symptomatic stretches that you can do for your SIJ dysfunction in the hopes of making your pelvis function a little bit better and help your symptoms settle down as quickly as possible. So as always, before we get to these exercises, we need to tick off two important concepts. The first is that we want to base everything that we do on results so that you don't have to trust me, you don't have to guess, you don't have to take a leap of faith. You can see if these exercises specifically help your symptoms. Whatever movement or activity lets you know how your SIJ symptoms are feeling, please do that first before doing each one of these exercises. Because once you've done each exercise, I want you to immediately retest that exact movement or activity again, so you can see if anything is tangibly changed. And the second thing is more so the anatomy of the SIJ. Your SIJ is just the connection between your pelvic bowl and where your spine and sacrum has jammed into that area. The SIJ isn't the most mobile joint, but it's also not a fused, lifeless joint at the same time. And this is important because the first exercise that we're going to get to is going to go hunting for some hip joint restrictions. And the reason why this is important is that your hip joint is the next mobile joint underneath your SIJ. So naturally, if you're missing some natural inherent range of motion in a very mobile joint, which is your hip, and you're still trying to do all the same tasks and activities that you need to do to enjoy your life, then there's a world where your SIJ may be compensating for a restriction close by. So let's dive into a very helpful hip joint capsule stretch. And if you can, join me on the floor. I want you to get onto your hands and knees. And the idea with this, as always, if we're trying to sort of stretch this side, we want to take your opposite leg back, and what we want to essentially do is you want to imagine that you're gently letting your thigh bone push out the back side of your hip. But the setup here is you want to keep your shoulders and hips together, keep your trunk sort of horizontal to the ground, and then we want to shift everything towards the side that you're working on. So we come across and we can come down a little bit. Again, we're looking for some gentle pressure at the side of the hip. The one mistake a lot of people make is they keep their hands here and they travel across, but they essentially dissociate the hips from the shoulders and they just dump their hip to the side. Sort of bending through your back, it's not quite as effective. Keep everything the same. Even if you don't move as far until you feel that tightness, it doesn't matter. We want quality over quantity. We just want to get you to hang out here for 30 seconds, 60 seconds, 2 minutes to ask that tissue to respectfully give. We're going to do this same technique 3 different ways, just to hit different parts of the hip joint capsule to see which one you feel is the most in need of mobility. And then once you've done that, we can come out of that again. And the second version is we're going to rotate underneath. So we're externally rotating the hip so the foot travels underneath. We're going to drop the back leg to block that. You can even pull that up further to take up more of the slack if you have that slack to give. The rest of the exercise is exactly the same again. We're going to shift your whole trunk, shoulders and hips together across to that side. This time you may feel the pressure a little bit more towards the back pocket as opposed to the side of the hip, but same thing again. We're going to find the best version of your tightness. Stay here for 30 seconds, 2 minutes, whatever you feel is comfortable, respectfully asking this tissue to give. If you do want to try and capture some of the soft tissue over the top, we can use the contract to relax exercise technique. We squeeze all the tissue in your butt cheek. Anything that feels tight, if you can tense that up for 5 to 10 seconds, when you give, it'll relax a little bit, which means you might be able to go a little bit further into the smoother stretch than you could before. And you can keep repeating that process, tense everything up for 5 to 10 seconds, relax. Again, let that tissue give, take up that slack, find the next best position. Then once you've done that one, we want to focus on the internal rotation bias of this exercise. So same thing, leg goes back again. This time, the side that you're trying to stretch, you want to rotate your leg so your foot travels away from you. Again, be mindful that if you go too far, you might start to take your hip with you and you'll bend your back to give you the illusion that it's going further. You want to keep your trunk still, rotate out as far as you feel comfortable. Same thing again, you can drop down a little bit, but we want to come across to that side. This time we're looking for a little bit more pressure around not the front, but a little bit more around the front than the previous two. If you feel like it's jamming up in your groin or in your hip somewhere, then come out of that deeper hip flexion. And you might find it's a more beneficial and encouraging stretch. Same deal, 30 seconds, 2 minutes, whatever's comfortable. Immediately recheck your movements and activities that generate your SIJ pain to see if loosening up your hip has fed enough slack into the system to help your nervous system start to feel better about your SIJ dysfunction. For some people, it is the biggest missing piece of the puzzle. So please let me know how you felt you went with that exercise. Because once you've done that, the next exercise we want to try is the other biggest missing piece of the puzzle that I find, and that's dysfunction at the base of your rib cage and the top of your lower back. So the interesting thing about this exercise, we're actually looking for the base of that rib cage and the top of your lower back. Why? Because that's the section of your spine that can refer pain to your SIJ. Again, do your same movement or activity first that alerts you to how your symptoms feel. Then grab a ball of some sort or a foam roller, whatever you feel is most comfortable for you. But we want to take that ball or roller and we want to start somewhere close to where you would imagine the base of your rib cage is. We want to place the ball right in the middle where the big bumps are, but this time we want to let it roll directly off to the fleshy bit on the side. This is where the spinal joints tend to be, and if these spinal joints are stiff, tight, restricted, overloaded, they can refer pain to any part of the body that they associate with, and in this area it can be in and around that SIJ. We want to gently lean back and lie down on the floor. You can absolutely do this sitting or standing up against a wall. Choose the position that's most comfortable for you, but as we do all the time on this channel, the way to do this exercise the best is we aren't necessarily looking for the spots that feel the most sore and tender for you. We still want to respect them. We care more about the spots that you feel are the stiffest, the thickest, the tightest, the most dense, or the most restricted. And generally, the only way for you to understand what that actually means is if you are on one side of the spine, at that level that's kind of at the base of your rib cage, compare that side to the exact same spot on the other side and take note of which side you feel sinks in easier, regardless of which side hurts the most, if at all. For me, I'm stiffer and more restricted on my left-hand side, so I know that I would need to be here if I happen to have SIJ pain on either side. Try and get a sense of which side doesn't sink in the best, which may indicate that it is restricted. We just want to leave the ball here and encourage that ball to sink into that soft tissue, but hopefully sink through that soft tissue and start to mobilize the joints underneath. We can do the same thing that we did with the hip joint capsule stretch, where we can sort of tense the muscles over the top, squeeze them for 5 to 10 seconds, and then relax. The ball might sink in a little bit easier, it might become a little less tender, but we want to spend a minute or two, or however long you feel you need to be here, to start to feel a sense of relaxation, or that something's starting to mobilize a little bit better. Then once you've done that, you can systematically move the ball up a little bit, or down a little bit. Just go hunting all the way up and down for anything that feels restricted or dysfunctional, especially when compared to the other side. Because again, once you've done that and you've had enough of that, immediately stand up, immediately recheck the exact same movement or activity that you've been doing that lets you know how your SIJ symptoms are feeling. Because again, if you do this exercise and you feel your symptoms have immediately changed to whatever degree, you may have just uncovered the root underlying cause of those symptoms. And then if you are a member of the channel, we now want to go through 2 more symptomatic related exercises that you can do that will hopefully help improve how your pelvis and SIJ as a whole are functioning. So at the end of the day, I want a video like this to hopefully broaden your perspective a little bit when thinking about your SIJ pain. I certainly don't want to take away from all the really helpful SIJ specific exercises that you may have tried or been given before. But in my experience, if we don't take that bigger step back and look at more than just your SIJ, we may never truly understand exactly why one part of your body has become dysfunctional when ultimately it shouldn't. And because everything has to happen for a reason musculoskeletally, if you find that your hip is stiff, stiff, or your lower back is a bit stiff in some random spots that you may never have thought of. And when you improve those, you feel like your SIJ symptoms improve as well. Interestingly enough, there also has to be a reason why those things have become a problem as well. And without going too long into it, because I talk about this a lot on the channel, if your hip is a bit stiff or your lower back is a bit stiff, generally for most people, that is a legacy of sitting postures, sitting shapes, time spent sitting. And if we're ever truly going to resolve and solve this issue forever, we need that broader context. We need to change something about how you load up that SIJ and most likely the tissue above and below that to give your body the best chance to have a different outcome going forwards. So again, let me know in the comments down below, did those exercises genuinely make a difference to your SIJ symptoms? If you did find it helpful and insightful, please leave a like on the video, subscribe to the channel. We're so close to 100,000 subscribers. If you do want an extended version of this video, please consider becoming a member. But at the end of the day, I genuinely hope that was helpful. I hope to see you next time.